Hi everyone, this is Melissa. I just wanted to make a quick video for you guys to go over the email that I sent you because I realized that it might have been a little bit confusing just because most of you aren't really familiar with the CAATE standards, specifically the new ones. And although the CAATE has told me that they might ask you all about these standards, I realized that not all of them pertain to you. So I wanted to just run through them really quick so that you will know at least what we're thinking with them, and you might be able to answer some questions for them. But if not, if they ask you questions that you aren't familiar with, don't make something up. Just tell them, say, I don't know, I'm not familiar with that, and that'll be fine. So just to run through these really quick, standard number 8, planned interprofessional education is incorporated within the professional program. Our students are all they all practice interprofessional education with us during school hours. We have a couple days that we work with the nursing school where we do full simulations. We work with EMTs, we work with the OTs, we work with teacher ed. We do a lot of this, and it's planned. If it were to happen in the clinical setting where they're interacting with a doctor or they're interacting with a nurse or an OT or a PT, that's awesome. We're super excited for that. That's why we have them with you in the clinical setting. But that's usually not planned. So we fulfill this standard in the education that we do here on campus. Standard number 9, all of our standards that we evaluate them on in the skills that you guys evaluate them on are all standards 56 through 94. They're all at the graduate level. Every class that our students are enrolled in is a 600 level class, and that's the graduate level. It's within the professional program. We don't let them evaluate any of those standards outside the professional program. Standard 13 is about time commitment. This one's basically making sure that we're not making them work so many clinical hours that it affects their academic grades. We track their hours, as you guys know, and if for some reason someone is struggling academically, we can go back and look at their clinical hours to make sure that we're not overloading them in the clinic. To date, this hasn't happened. Hopefully it never does, but that safeguard is there just in case. All of our clinical education all happens within 2 academic years for Standard 14. Standard 15, our clinical and supplemental clinical experiences all have a logical progression. Basically, as we teach them more of standards 56 through 94, which is the curricular content standards, then we expect them to do more things in the clinic with you guys, eventually working towards autonomous care, which you guys are still supervising them because you're their preceptors. But when they're in their 6th semester, like some of our second-year students are right now, we expect them to be able to do a lot of stuff on their own. Standard 16, at least 1 athletic training immersion experience. We have 2 in our curriculum. Some of you guys are preceptors for those. Others of you are not, but we do our clinical immersion experiences, one in July/August between their 1st and 2nd year, and then we do the second one in March to May of their 2nd year. So basically spring break to graduation of their 2nd year. So those are our 2 immersion experiences. This one you guys probably remember from when you were in undergrad. It's worded a little differently now, but that they have to see populations throughout the lifespan. So pediatric, adult, and elderly, different sexes, different socioeconomic statuses, which by the way, a different socioeconomic status does not necessarily mean we're dealing with poor individuals. It can also mean that they come from another country, or maybe their health insurance is different than what we're used to dealing with. Maybe they have a military background, and therefore we have to figure out how to do their insurance through TRICARE. Socioeconomic status does not mean poor. We usually think that, but that's not what it means. We've educated our students about that, and we just ask them when they track their hours to check yes or no if they've dealt with a different socioeconomic status than they're used to. Varying levels of activity, competitive, recreational, individual, high, low. You guys probably all remember that. And then non-sport, so military, industrial, leisure, and performing arts. So if they're just seeing patients with any of those things, then they check those boxes when they're tracking their hours. A variety of health conditions commonly seen. This is where they come up with not just musculoskeletal, but, reproductive issues or mental health issues. All of those things fall under Standard 18. Number 23 and 24 is really interesting. I don't know why they would ask our preceptors about that, but that's part of the reason I want to talk to you guys. Standard 23 and 24, all of these items are found in our Masters of Athletic Training handbook. That handbook is actually on our website in case you guys ever wanted to see it, acu.edu/MAT. There's a hyperlink to it. It's a 44-page PDF, and you're welcome to read it. But all of these things are in that handbook. Standard 26, there's a lot of points to that. This one is most important to our students. I hound them on this all the time. You guys should too as preceptors. The way we differentiate is by them wearing their name tags. So that's why I'm always telling our students to wear their name tags. CAATE is going to hit heavy on this one when they show up to make sure that all of our students, our MAT students, are wearing their name tags. 26B is CPR training. We train them all in the June when they first start. Every one of them has done bloodborne pathogen training, and we have exposure plans posted in all of your athletic training rooms for them. This one is another one we dealt with you guys. We just made sure all of your machines are calibrated, making sure all those stickers are there, and we have the certificates of calibration. Every student has the communicable and infectious disease procedure. It's in their handbook also. They've signed off on it. Every student has their immunizations. We make sure we check that every semester before they go to their clinical site. Every one of them has been through HIPAA and FERPA training. We also have that signed off and in their files. Radiation exposure. This one doesn't really have to do with many of our sites unless you're at ABJ, in which case we follow the radiation exposure plan that your facility has. Sanitation, basically that students have a place to wash their hands while they're in the clinical site. Venue-specific training, that's something we ask you guys to go over with the students on their first day in your clinic. Basically, your expectations of them, be on time, wear your name tag, dress appropriately, stuff like that. And then also venue-specific EAPs, which we also ask you guys to go over and should all be posted in your training rooms. Standard 29 kind of goes with 26J, expectations. But this is that you're oriented to your site. That's that first day of their site that you guys are telling them what you expect from them and the policies and procedures of your site. Standard 30 is pretty straightforward. Obviously, we place students in settings where we think they're going to be successful. It has nothing to do with their race or sex or age or any of that stuff. 31, you guys are our preceptors and you're supervising our students. And you guys are either athletic trainers or physicians. 32 is regular and ongoing communication between us, meaning myself or Adam or Ro, and you guys as the preceptors. And finally, 33, that we come by at least once a year. We try and do once a semester, but the minimum is once a year that we come by and evaluate your clinical site. So that pretty much takes care of it. If you guys have any questions about any of these, please, please, please let me know. Just shoot me an email, and I would be happy to answer any of it. Besides that, I really, really appreciate you guys being a preceptor for us. You don't even know how much you guys are impacting our students' lives. You guys are amazing. Thank you so much, and we will be in your clinics Tuesday of next week. So Tuesday of next week, meaning the 28th. So if you guys have any questions, please let me know before then. All right, we'll talk to you soon. Thanks so much. Bye.